There is a revolution happening in medicine. Medicine itself is once again evolving. In days past, microbes were not considered a cause of infection. Today, we know better. Heart disease is the #1 killer in America, and we now know how to prevent heart attack and stroke instead of just treating it after the fact. We know that today because Dr. Bradley Bale and Dr. Amy Doneen have developed the Bale Doneen Method of heart attack and stroke prevention. Here to tell you about it is Dr. Bradley Bale and Dr. Amy Doneen.
Yeah, we're excited to let you know you're in a practice that has been trained in the Bale Doneen method. Our method will ensure arterial wellness,
which is a method for the prevention of heart attacks, strokes, and type 2 diabetes. We have a book, it's called Beat the Heart Attack Gene, and we're excited to share that with you. Our book focuses scientific information to you, the public, so you can understand what causes disease, what the genetics are behind the disease, and allows you to make action steps to make sure that you do not suffer heart attacks, strokes, or type 2 diabetes in your lifetime. You are here today at a clinic that specializes also in the Bale Doneen method, so we're very excited to share this book and our information with you today.
Traditional American medicine is set up on a platform that waits for the end-stage disease, in other words, heart attacks and strokes, and then jumps in with treatments such as coronary bypass, stents, now looking at stem cell therapy, even transplants, rather miraculous things to help people who have the end-stage disease. But the problem with that, it causes a lot of financial and humanitarian suffering that's unnecessary. We can now prevent those end-stage occurrences.
Our method is founded upon a platform of wellness, and that is very different than the current standard of care. The current standard of care is a risk factor paradigm. And by that I mean the current risk factor paradigm, which is what you get in the standard of care medicine outside of a clinic like this, focuses on your risk only. And those are things like your age, your gender, your cholesterol numbers, your blood pressure numbers, and assesses treatment for you based on that risk profile. What we've learned over the last decade plus is that that may not be good enough. Many people who look fine on paper go on and have an event anyway. So what we've done is put together the science and put it together in a format for which we can assess for silent asymptomatic vascular disease, understand the inflammation behind that disease, and understand why you might have disease. And it's a pretty simplistic idea. We found out why you have disease, we treat that why, we see the inflammation stabilize, and we see the disease stabilize, which is far different than the current risk factor paradigm or the standard of care. The current standard American medicine is a tenuous platform. It's shaking on every angle, both from a financial standpoint and from a health and wellness standpoint. People are suffering heart attacks and suffering strokes both unexpectedly and recidivistically. People are having events over and over again, even when they're getting rescue type care. And quite frankly, it's just not good enough anymore. We can do better. Right now, the current statistics tell us this. Every 34 seconds, while you are sitting here and listening to this, someone is having a heart attack. Every minute, someone is dying from one of those events. The average age of someone having a heart attack, for men, it's under age 65. And for women, it's around age 70. That's when we hit retirement. That's when we've worked so hard to get to that age of independence. We want to do all the things in life that we plan so hard to do. The average numbers of years of life lost from us from having a heart attack is around 20. That's 20 years of life lost due to this disease state we call heart disease. Sudden cardiac death is responsible for more premature deaths than any other individual disease, including cancer. Annually, 2 million years of productive life is lost for men, and 1.25 million years is lost for women. We are here to say that does not have to happen to you. You do not have to be one of these statistics. Coronary artery disease causes the vast majority of sudden cardiac death. And knowing these statistics, that people are dying suddenly and unexpectedly of this disease state, our hope would be that more attention and resources would be allocated towards prevention. And sadly, what's happening is we are spending more and more resource on treating end-stage disease, putting more emphasis on things like defibrillators and things that treat people after they've had an event. And while that is important, survival is important, our idea is to back that train up and say, can we identify disease years and even decades before you were going to have an event and stop that event from ever occurring? Because at the end of the day, what we want to do is treat something, and if we do our job right, you never knew you had the disease in the first place. So the future, we believe, is preventing cardiovascular disease and treating the disease before it's even evident. That, we believe, is the key to optimal cardiovascular wellness, prevention through early detection. This goes into play for those individuals who've not had a heart attack or stroke, and it also is really important for those who've already had one event, because we know the recidivism of this disease state is terrible. People who have another event, 50% of them are going to die from that recidivistic event. What we know, what we have learned now over the last 10 to 15 years is, if we can identify why you had that first event, treat the why properly, we can stop a second one from occurring. That's prevention. So identify and halting arterial disease. Let's talk about that a little bit. Maya Angelou, who's so articulate in the world of poetry and writing, has something strong to say that we believe in, and that is,
we need to do the best we can until we know better. Once we know better, we need to do better. And your practitioner does know better and will do better with you. They're not going to wait for end-stage disease.
We have an acronym for our method. It's called EDFROG-IRA. And each of the letters stand for something really significant. The E stands for education. We believe everything good in life starts and ends with education. So the E stands for education, and that is not only educating ourselves, but educating you, the medical public. We believe that you can understand this disease state. We believe we can articulate it in such a way that you can understand what causes a heart attack or stroke. That's really important, so I want to talk to you about that today. The D stands for disease. We want to look for disease before it's evident, and we also want to monitor disease to know what it's doing. Let's go in and see if your treatment's actually stabilizing the disease or not. The F stands for fire or inflammation. Are your arteries inflamed? Is your treatment working? Because if it's working, you should have no inflammation. And we can measure that through a very simple panel of lab tests. And we'd like to do those very often, usually about every 3 months. The R stands for root causes. This is really important because oftentimes people think the only root cause of heart disease is cholesterol. What we've learned is that's one of many root causes. There are so many. One common one not getting enough press is called insulin resistance, even periodontal disease. There's all kinds of root causes. And what you'll understand with this method is it's key to find out all of the root causes. Once we know those, then we treat them. The O stands for optimal, and that is you deserve the most optimal care. That's why you're here. So setting optimal goals for yourself, having your provider set optimal goals with you, that's the key to wellness. And G, that stands for genetics. It's time to embrace genetics, both to identify your lifetime risk, but also to understand what medicine you'll genetically do better with than others. And then the IRA stands for individualized management, risk factor assessment. We want to go back in and say, are we doing a good job? Is your treatment handling your cholesterol, blood pressure, etc. well? We want to go back and look at those risk factors. And then the A stands for assessment annually. We want to go back and look at the disease. Are we doing a good job? If we are, the disease should stabilize and even regress in some individual patients. So that's what EDFROG-IRA stands for. One thing I want you to think about is the idea to wonder, are you at risk for heart disease?
It may surprise you that there are lots of red flags to indicate you could have risks that you probably aren't aware of. In women, some of those are polycystic ovary disease. If women have had miscarriages or stillbirths, if they have migraine headaches with aura, So it's not just having a family history of heart attacks and strokes. There are lots of red flags other than that that would indicate you should ask your provider for the Bale Doneen method type of care to make sure you're okay with your arteries.
All of these conditions make you at increased risk for developing plaque in your arteries in your lifetime. So if you have any of these red flags, you need to ask, can you tell me if I have hidden plaque in the walls of my arteries? Do I have inflammation? Can you help me with that? Red flags that are more specific for men might be things like sleep abnormalities, history of migraine for men as well, erectile dysfunction, lack of sleep, even various career fields for both men and women, but some career fields seem to be more gender biased. Things like firefighters or even men and women who are on the police force. Those fight or flight fields have an increased risk of heart disease for various reasons. There's all kinds of reasons for that. But whatever your red flags might be, and they're extensive, ask the right question. Do you have plaque and do you have vascular inflammation? So let's start into it. So E stands for education. What really causes plaque? What really causes heart attack? What we've thought may be not right, and that is what we see on TV, what sometimes we see even on brochures. Oftentimes people think it's cholesterol that blocks the flow of blood, but indeed that's not really the case. Our bodies are much smarter than that. Our bodies try to protect us for as long as we can. So what happens is, as we age, as we deal with things like cholesterol abnormalities, as we deal with things like inflammation, our body silently deposits that plaque or deposits those cholesterol molecules and deposits that inflammation in the wall of the artery.
The inside lining of our arteries is called the endothelium. We prefer to call that the tennis court, because if you took all those cells out of your body, you could easily cover 5 to 6 tennis courts. And that tennis court's the most important thing, arguably, you have going on for you.
And what happens is that tennis court can crack over time, and cholesterol molecules can get through that tennis court and silently hide underneath it, leaving the artery wide open for blood flow. But the problem is, if someone was to undergo an acute inflammatory response, it could be anything. It could be a periodontal abscess, it could be cholesterol, it could be blood pressure, it could be lack of sleep, it could be a stress event. That tennis court could crack again. And if that tennis court cracks again, you get exposure of that cholesterol buildup in the wall of the artery, and the body says, aha, I can heal that, just like it's going to heal a cut. And the body heals it with a scab or a clot, or the fancy way to say that is a thrombus. And that blood clot or thrombus now blocks the flow of blood. And if that blood clot happens to occur in the heart, we'll call it a heart attack. If the clot occurs in the brain, we'll call it a stroke. So wherever the clot occurs, we'll give it its clinical name. That's what causes a heart attack. So plaque is initially very silent. We don't feel it. We do not feel plaque as it builds up silently in the artery wall. It's your provider's job, your physician or your practitioner's job to find this for you, because you're not going to feel it to tell them about it. So, but the idea is, if you can find it at this stage where it's hiding in the artery wall, the next question is find out why it's there and do something about it. Because if you don't do something about it, this can happen. And that is where that plaque wants to rupture through that artery wall, and the body says, aha, I'm going to heal that. And the body sends in everything it needs to heal that rupture, and it forms a clot. And that clot is called a thrombus. And like I said before, if that clot blocks the flow of blood anywhere in the body, we're going to give it its clinical name. And that's the problem. We fix the clot sometimes, and we don't fix the plaque in the artery wall. I'm going to show you a quick animation of this so it brings it to light. What you'll see in this image is a picture of arteries, and I want to show you 3 different depictions. The first depiction is what a nice healthy artery looks like. So as we move in closer to this lumen, I want to show you a couple things. The first thing, you'll see a nice healthy endothelial wall, and you'll see endothelial cells tightly bound together. You'll see red blood cells, white blood cells drifting through the lumen. That's a nice healthy vessel. You see the intima, you see a nice healthy vessel. The second vessel we're going to look at is one that has plaque in the artery wall. So there has been a first failure of that tennis court. You see a nice thick plaque or cap that's formed on that plaque. So the likelihood of a rupture is small. It's a stable plaque. Now I want to show you an artery that has plaque embedded within the artery wall, so there's been a first failure. And you see the activity through that endothelium or tennis court. You see foam cells that are going to aggregate together. You see LDL oxidation. You see a rupture of this endothelium, and the body's autoimmune response to that is to heal that immediately. And that immediate healing process forms a thrombus. And that thrombus or clot is going to block blood flow to the surrounding tissue around that lesion, and that's what we call a heart attack.
That's the type of buildup that causes most heart attacks. It's silent, but potentially deadly. And we've nicknamed that the cat in the gutter. It's like a cat sitting crouched in a gutter just low enough that the pigeons around it can't see it. And a pigeon gets close enough and it leaps out. That's what this disease is like in the walls of our arteries.
And so the idea of our method is to find any cats that are hiding in your gutter anywhere in your body as early as possible. And if we do that successfully, we can prevent that cat from ever jumping out of any artery or gutter that you have in your body. So do we have the technology to identify plaque in the artery wall or a cat in the gutter early? And the answer to that is, of course we do. The technology we have available is very simple. It's non-invasive, meaning it doesn't hurt to have it done. There's little or no harm with the technology. So let's talk about a couple tests that you can ask for. One is called a coronary artery calcium scan, and that's like getting an x-ray. Doesn't hurt, you don't even need to take your shirt off, and you just lay in a machine and they quickly do an x-ray of your chest, and they look for the presence of plaque in the arteries around the heart. You can see this by the bright white spots on this x-ray image or CT image you see on the screen. That's not normal, by the way. It's not normal to have calcium in any arterial bed. We have 60,000 miles of vessels in our body from head to toe. What we're trying to do is find out if you have any plaque anywhere from head to toe, and if you have it anywhere, whether it be in the arteries in the heart like you see in this picture, or the arteries of the neck, or in the leg, anywhere, it's not a normal stage of aging. It does happen to be very common. It's the leading cause of death and disability, but it's never considered normal, and it should always be dealt with. But this is one technology called a coronary calcium test, coronary CT. The other one that we use a lot is great as well, and it's called a carotid intima media thickness test. And it uses ultrasound, and it looks at the arteries of your neck. And those are very easy to get to because they're so close to the skin surface, and it gives us some great information. It tells us how old your arteries are. It gives us an age match, gender match comparison. It tells us if you have any plaque hiding in the artery walls. And what we do know with this technology is if you have plaque in the arteries of the neck, you more than likely have it in the arteries of your heart, abdomen, legs, everywhere in your body. So it's a wonderful surrogate marker to take a window peek into all of those arteries to find out what's going on in your artery wall. And this is a technology that we like to measure annually to know, is the disease getting better? Is it stabilizing? What's happening with that disease? Any imaging that you've ever had done, whether it be a chest x-ray, whether it be a scan of any type, you can review those images with your provider and look for calcification or any abnormalities within the vascular system. Because if you find plaque or calcium in any of those arteries, it means that you have atherosclerosis. So be wise and look for those types of clues, and you'll work with your provider on that opportunity. Because remember, the goal is to find a cat and not let it jump out ever. For example, sometimes at the dentist they do a panoramic film where they want to look at all of your teeth, and sometimes even in that type of image they can see calcification in the carotid arteries as well. That may be your first clue that you have silent plaque. that has grown in the walls of your artery. So pay attention to all these little clues. It's a wonderful opportunity. So what you want to know is, you want to know, gosh, do you not have any plaque, or do you not have a cat in the gutter? We would term that primary prevention. So your lifelong goal with your provider is to work together in partnership to make sure you never develop plaque in those arteries. Wonderful goal. Secondary prevention means, yeah, there's a cat in that gutter. There's plaque in your artery walls somewhere. The lifetime goal that you have with your provider to work in partnership is to make sure that cat never jumps out, ever, for your whole lifetime. So you can prevent things like heart attacks, strokes, dementia, peripheral arterial disease, erectile dysfunction, all of those disease states that are caused from that cat leaping out. Tertiary prevention means we know you have plaque in the arteries. That the cat's leaped out once. Maybe you've had a heart attack, a stroke, maybe you have a stent, maybe you've had bypass surgery, maybe you have peripheral arterial disease. The cat's jumped out at least once. The goal is to find out why it jumped out once, treat that why, and never ever for your lifetime let that cat jump out again. That's tertiary prevention. So work with your provider and understand very clearly, are you primary, secondary, or tertiary? Because your goal attainment is going to be very different. But ultimately, the goal for all three is to never, ever, ever suffer a heart attack or stroke. So that's the difference, right? Find out if you have disease and never let that disease cause a vascular event, which is very different than the current risk factor, which simply treats your cholesterol or your blood pressure and assumes that that's going to be enough. That may or may not be enough. So let's talk about what else we can do. How do we actually halt that disease from misbehaving or jumping out? How do we do that? Well, what we do is we need to understand the inflammation associated with that disease. As I mentioned previously, there's 2 layers of the artery wall that we can assess clinically. The first layer we call the tennis court is the endothelium. And there's certain lab tests that we can look at to assess the stability or the activity of that tennis court. And then we can look behind or underneath that tennis court and find out, is the plaque active? We can look there as well. But what we know with inflammation is not only is it causal of events happening, meaning a heart attack or stroke, but inflammation is also causal of plaque even getting in the gutter, plaque actually getting into the artery wall. So the idea and the premise here, why it's so important, is to stop inflammation from every angle. So whatever the source of your inflammation, if you stop it, you can have the opportunity to stop disease from ever developing and stop disease from causing an event. What a great opportunity that is. So how do we assess how hot or how inflamed that artery is? That's really important, and that's what we want to do clinically. And that's very important for your laboratory testing to understand which test you're going to measure to know the health and wellness of your arterial wall. The next step in the Bale Doneen method, and this is an exciting opportunity, is to lay all the cards on the table. Understand, okay, if I have vascular inflammation, if I have a cat in the gutter, if I have disease, what caused it? It may be cholesterol abnormalities, it may be. But it may be other things like genetically inherited lipid abnormalities like lipoprotein A. It may be something like periodontal pathogens. It may be obstructive sleep apnea. It may be secondhand smoke exposure. It may be psychosocial issues. It may be something called insulin resistance. There are lots of root causes of vascular disease that the current standard of care is not going to assess for you. That's why you're here. Because what you want to do is understand, do you have any of these root causes? And the exciting message I want you to hear today is that all of these root causes are treatable. All of them. You just need to know which ones you have. And it's your responsibility to work with your provider to treat all of them. It does take a global approach to treat all of them, and it takes a partnership in care. So it takes effort to understand if you have periodontal disease, you need to make efforts at home to care for that. If you have insulin resistance, you need to make lifestyle choices that are going to impact your insulin resistance. You need to be willing to get a sleep study. You need to work with your provider in partnership to know what your root causes are. But once you identify them, you have the chance to never, ever have a heart attack or stroke and never become a statistic. What a great opportunity this is. We also talk about O. Remember the O in EdFrog? O is optimal. So you want to set, and you deserve, by the way, optimal goals. you know, in school we get a report card, or we used to get a report card, right? And you can pass with a C, but come on, this is your health, this is your life. You deserve better than a C. We want to go for A's. And so in order to get an A, you really need to be treated as the unique, wonderful individual you are. We believe that the standard of care is more set up on a C report card. That's not good enough for you. You're way more unique and special than that. So strive for A's, both for yourself, and make sure your provider is giving you A-type optimal care as well. You deserve individualized therapy, individualized counseling, and individualized care. So when you look at cholesterol, realize that there's all types of cholesterol out there, and setting optimal goals for your cholesterol means paying attention to all of the bad guys that are associated with plaque development. So looking for the good of the good, the bad of the bad, and understanding the cholesterol variances will help you achieve those A's on your report card and strive for optimal goals. Genetics, it's time to embrace genetics. It's one of the most cost-effective tools we have because you only have to measure them once, but their utility goes on for decades, right? Because what you know you're genetically predisposed to is going to help your children and your grandchildren, which is great. So genetics give us two great clinical opportunities. The first one is to identify your lifetime risk of developing a different disease state. So if you are genetically more likely to develop things like aneurysms or heart disease, you're going to get screened more often and more regularly than someone perhaps that isn't more genetically predisposed. The other thing that genetics allow us to do is something called pharmacogenetics, and that is to guide our treatments based on your genetic needs. Certain people will respond differently to certain medications or statins based on their genetic profile. What you eat, should you have alcohol, should you exercise a certain way, should you have higher fats, lower fats, carbohydrates, all of that is based on your genetic profile. That's why we all respond differently to certain diet plans. So in our book, Beat the Heart Attack Gene, and in this clinic today, you can get your genetics tested to know how you should guide your individual advice. It's a great opportunity, so don't miss out on that.
And the Chinese told us 4,500 years ago, a superior healthcare provider prevents disease. A mediocre provider treats disease before it's evident. An inferior provider treats the full-blown disease. We've been on that inferior platform. We no longer need to remain there. Your healthcare provider has chosen to move on to a better platform of prevention, or at minimum treating disease before it's evident. You're fortunate to be in this clinic that can provide that type of care. We encourage you to take advantage of it, to talk to them more about getting in to the Bale Doneen Method type of program. They can do that for you. It could literally save your life and add years of quality to your life.
So that's our goal. It is to prevent disease forever and always in your body, and to work with you in partnership and your providers here at this clinic to make sure that you live a life of wellness, complete and total arterial wellness, and live forever without suffering the brutal effects of heart attacks, strokes, and type 2 diabetes.